First, we'd like to thank SAGES for inviting us to speak on this topic. My only disclosure is serving as a consultant for the advisory board with AstraZeneca on the management of lung cancer.
And I have no relevant disclosures.
We were asked to speak to how to be really successful in academia. Well, that topic kind of stumped us, so we decided to start at the beginning. What is success? In consulting the dictionary, we found that success is a degree or measure of succeeding. That was wholly unsatisfying, as the definition provided included the term we were seeking to define. So we did what everyone else does these days. We looked up a TED Talk and found that success is feeling that tingle of excitement about what you do, sticking with what matters through hard times, and living a life you can feel proud of. Then we decided that perhaps a TED Talk wasn't the best reference possible. So we searched for more answers and found a video of the Dalai Lama in which he answered the question, what is a successful life? And he said that success means an individual carrying on a meaningful life, serving others as much as possible. As surgeons, I think we can all identify with that. But then, what is academia? Academia is defined as the environment or community concerned with the pursuit of research, education, and scholarship. Great, but is that to mean that only tertiary care centers or university-based practices are? I would argue not, as plenty of community hospitals engage in research, education, and scholarship. And certainly if one is a member of SAGES, I would also argue that this organization in and of itself is an environment concerned with pursuit of research, education, and scholarship. But if one were to subscribe to the fact that academia is a more formal university-based practice, then success in academia can be described as meeting the criteria set forth by an institution's promotion and tenure committee for the successful progression through the ranks of professorship. And that is usually measured by contributions in the areas of service, teaching, and research. And I will define each of those for you. Service, first and foremost, is providing excellent clinical care. That would mean taking care of patients well, with good clinical outcomes and good patient reviews. In that, P&T committees often like seeing that one has developed a clinical niche or participated in a programmatic development. Service can also be extended to the community. In a university-based practice, that can include being a member of various medical school committees, such as promotion and tenure, diversity, or the faculty council committees. Service to the community also includes serving on local or regional organizations, such as the American Cancer Society or charities, and serving on the board of directors of such organizations, for instance. And lastly, service can be to the profession. Being a member of national organizations is important. However, serving on committees and certainly chairing a committee is viewed very highly during the P&T process. Teaching is self-explanatory. It includes the education of any level of learners, including teaching medical students, surgical residents, and fellows. This can also be pan-disciplinary, such as teaching PA, nursing, or pharmacy students. It also includes teaching colleagues, such as serving as faculty in one of the SAGES Adopt courses. Teaching on the next level includes curriculum development. This can be participating on a national level with the development of milestones, entrustable professional activities, EPAs, or simulation efforts. And as for research, this can be of any kind. Research can include clinical, translational, or basic science projects. As with everything, funding matters. It is often easier to acquire local institutional funding as part of startup funds. That being said, national professional organizations often have funding sources, particularly career development awards, general research awards, and more recently, COVID-19 research awards. And of course, the crown jewel of research funding is government funding, such as NIH, NCI, or DoD grants. However, those are few and far between. Also be mindful that work not published is work not done. Dissemination of your research and knowledge is a must during the P&T process. Dissemination includes presentations at local, regional, national, international conferences, writing textbook chapters, or being an editor for a textbook, and of course, publications in peer-reviewed journals. The ratio of first or senior authorship to the total number of publications matters, as always being a middle author does not weight as heavily. And finally, the impact factor of journals are also noted. In general, in order to progress from an assistant to an associate professor, one has to demonstrate an emerging national reputation. And in order to progress from associate to full professor, one has to have a sustained national reputation and an emerging international reputation.
That's all fine, Dr. Seppa, but how does one really achieve this? And by the way, nice Photoshop skills. We all know that life is dynamic, nonlinear, and unpredictable. So how do we set ourselves up for academic success? First and foremost, we need to choose our environment wisely. An environment that has mentors and role models who you personally respect and ones who you realize the importance of balancing work with life. Also get to know the institution's culture and policies prior to taking the job. Are your colleagues collaborative and have similar goals of providing first-rate care, program development, dedication to education and research? If not, it's going to be really hard to get things accomplished when you don't have buy-in from your partners. We all know there are many ways to skin a cat, but if you find your passion in a supportive environment, it will naturally lead to success in service and research and eventually self-fulfillment as you define it. There are numerous examples of successful mentors and colleagues that stand out in my mind. Dr. Pryor, for instance, has always had a passion for innovation since she was a resident. And this has ultimately led to her SAGE's presidency theme of the next big thing. Dr. Stefanidis' passion for surgical education has resulted in numerous national grants and his current vice chair in education position at Indiana University, in addition to many other leadership positions. Dr. Ross Goldberg's passion for advocacy is palpable to all of those who surround him, and over the years has resulted in numerous prestigious awards, and more importantly, societal impact through political efforts both locally and nationally. You also must find a niche, one that you are passionate about. After finishing fellowship, my co-fellow and I were charged with getting a hernia center up and running, along with Dr. Wright. This provided us an opportunity to increase my skill set by attending numerous courses and develop a referral base through marketing, neighborhood clinic talks, grand rounds, and local society talks. In addition, we spent time developing and optimizing perioperative protocols, nursing unit teaching sessions, and so on. With the development of the program came the opportunity to enhance medical student and residency education, develop research proposals, and so forth. The ability to encourage niche development and focus for junior faculty, in my opinion, is a sign of a great leader, which I credit Dr. Brandt Oschlager. You must get involved locally and nationally, and do so early on as a medical student, and if not a medical student, as a resident. Be selective about which societies you join. Don't spread yourself thin. Make a point to attend that meeting annually. When you do join, delve in. Join a committee that aligns with your professional and personal interests. Be an active member of that committee and seek out opportunities. And if possible, bring your family to annual society meetings and get them involved. Seek out research funding and do so early on. Make a list of societal, career, and grant opportunities, then ask for advice. Use what is available from the society. For SAGES, we provide the scoring criteria, have the perfect grant examples posted on our website, in addition to hosting workshops and having past talks on grantsmanship and webinars readily available. If your grant proposal does not get funded, don't give up, but reapply, reapply, and reapply. The grant review committees spend a great amount of time providing thoughtful consensus feedback. Implement that feedback and write a cover letter stating that you implemented the feedback when reapplying. Balance is a really interesting concept. It's not like you find it and then you're done. You're always trying to find it. Over the years, I've been fortunate to have numerous colleagues, mentors, and coaches who I have learned a great deal from regarding work-life balance. My best friend, for instance, Dr. Seppa, has been a true example of how one can excel academically while juggling a dual surgeon household with at one time 3 kids under the age of 3. Keep active to optimize your mental and physical health. When your chairman starts Team Peloton, join the ride. Most importantly, be flexible, as we never have complete control, and by all means, have a sense of humor. There's nothing magical about 10 years. Accomplish what you want on your own timeline. And remember, in the words of the Dalai Lama,
is trust. And I think survival of humanity, not technology, but ultimately, I think trust, friendship. So people, you see, who have sort of these sort of value become part of your life, then your life could be considered as a successful life. I feel that way.
thank you for your attention.